Good morning, it's May 23rd, and this is your daily brief in science. Here's everything you need to know. A recent study published in the journal Cell has unveiled innovative contact lenses that allow wearers to perceive infrared light, a spectrum typically invisible to the human eye. This groundbreaking research was led by neuroscientist Tian Xue from the University of Science and Technology of China, in collaboration with materials scientists and optical experts. The lenses incorporate nanoparticles that convert near-infrared light into visible light, enabling users to see infrared signals clearly. The primary goal of this technology is to expand human vision beyond the narrow range of wavelengths visible to our eyes, which is less than 0.01% of the electromagnetic spectrum. Initial tests conducted on mice demonstrated the lens's effectiveness. The animals showed a preference for a dark box over one illuminated with infrared light, indicating successful infrared vision. The estimated manufacturing cost of the lenses is around $200 per pair, which could make them accessible for various applications. Currently, the lenses have been tested on a small group of individuals with normal vision in China, with plans for further testing to assess their applicability across a more diverse population. Future studies will explore the potential benefits for individuals with vision impairments, as well as the safety and long-term effects on eye health. The technology could also enhance medical practices, allowing surgeons to see near-infrared signals directly, which may improve procedures that currently depend on separate monitors. Potential applications for these lenses include improving visibility for first responders in hazardous environments, such as fires or dense fog. While the lenses do not create new colors, they convert infrared light into familiar visible colors, which could have significant implications for security and encryption. However, it is important to note that the current technology only works with infrared LED sources and near-infrared light, specifically wavelengths up to 1,600 nanometers, and does not detect thermal radiation emitted by the human body. The FDA has mandated expanded warning labels for the Pfizer-BioNTech and Moderna COVID-19 vaccines, specifically addressing the rare risks of myocarditis and pericarditis. Recent data reveals a rate of approximately 8 cases of these heart conditions per million doses administered to individuals under 65. However, this rate spikes to 38 cases per million among males aged 16 to 25. The FDA's announcement highlights that heart MRI scans of affected individuals have shown improvement over time, although the long-term effects of myocarditis following vaccination remain uncertain. Ongoing studies are currently assessing any potential long-term heart effects in those who experienced myocarditis after receiving an mRNA vaccine. A spokesperson from the Department of Health and Human Services stated that the changes in labeling are intended to promote transparency about vaccine safety and efficacy. This announcement comes at a time when a Senate hearing is investigating the transparency of health officials regarding vaccine-related adverse events, particularly myocarditis. During this hearing, some claims suggested that the Biden administration downplayed vaccine risks, a point that health officials disputed by citing effective vaccine safety monitoring. Despite criticism from anti-vaccine activists, the FDA maintains that COVID-19 vaccines have undergone the most rigorous safety evaluations in U.S. history and continue to be monitored closely. Experts are calling for more placebo-controlled trials to better understand the benefits of COVID-19 vaccines for healthy children and adults before making broader recommendations. Pfizer and Moderna have 30 days to respond to the FDA's request for labeling changes. However, neither company has issued a public comment on this matter yet. In Hawaii, Governor Josh Green defended the public health responses to vaccine-related concerns, asserting that the safety tests and monitoring systems have functioned effectively. Cardiologist Stephen Nissen emphasized that the risk of myocarditis from the vaccine is significantly lower than the risk of severe outcomes from COVID-19 itself, reinforcing the importance of vaccination for public health. The UK Health Security Agency has made a concerning announcement. West-Nile virus has been detected in mosquitoes in the UK for the first time. This finding raises alarms about the potential for outbreaks, as the virus could establish itself in the region. Professor James Logan from the UKHSA highlighted that the detection may indicate the virus's potential establishment, contingent on various environmental and human factors. Warmer temperatures are particularly critical, as they enable the virus to replicate within mosquitoes, which could facilitate its spread. In light of this detection, additional screening efforts will be initiated in Nottinghamshire, an area not typically included in the screening program. Recent testing in high-risk areas of England showed that out of over 30,000 mosquitoes and 300 birds, only 2 pools of mosquitoes tested positive for the virus. West-Nile virus primarily spreads to humans through mosquito bites, with severe illness occurring in approximately 1 in 150 infected individuals. Severe symptoms can include high fever, severe headache, neck stiffness, confusion, and muscle weakness, particularly affecting older adults and those with underlying health conditions. Recovery from severe illness can take weeks or months, and around 10% of those with severe neurological symptoms may not survive. The detection was described as a result of potluck during a research project conducted by the UKHSA and the Animal and Plant Health Agency. Although the current risk remains low, the UKHSA is enhancing its surveillance and control activities to monitor the situation closely. Experts recommend preventive measures such as wearing long clothing, using insect repellents containing DEET, and eliminating standing water to reduce mosquito breeding. While West Nile virus has not historically caused significant public health issues in Northern Europe, increased surveillance is deemed essential due to the potential for unnoticed infections. NASA's Perseverance rover has reached a remarkable milestone, celebrating its 1,500th soul on Mars with a captivating selfie taken on May 10, 2025. This image features a dust devil in the background, showcasing the dynamic environment of the Martian surface. Currently, Perseverance is exploring the Jezero crater, an ancient lake bed and river delta, where it is investigating signs of past microbial life. The rover is operating along the western rim of Jezero crater in a specific region known as Crocodylon. Since its launch in 2020, Perseverance has traveled over 22 miles, conducting extensive geological work. The rover has analyzed 37 rocks and boulders and collected 26 sealed rock cores, contributing significantly to our understanding of the Martian landscape. Project manager Art Thompson confirmed that despite the accumulation of red dust from drilling, all systems on the rover remain operational and continue to provide valuable scientific data. A recent health report indicates that Perseverance is in excellent condition, ensuring that it will continue its scientific research for the foreseeable future. The selfies taken by the rover team serve a dual purpose. They monitor dust accumulation, which is crucial for solar panel efficiency, although Perseverance is primarily powered by a nuclear battery. The recent selfie, a composite of 59 images, took an hour to assemble, as noted by imaging scientist Megan Wu. The inclusion of the dust devil in the selfie enhances its appeal, making it a classic representation of Mars. The bright lighting in the photo is due to the high angle of the sun at the time, which illuminated the rover's deck and created a distinct shadow. Additionally, to create an alternate version of the selfie focusing on the Bell Island borehole, the Watson camera required 3 extra images and 62 precise movements of the robotic arm. In the selfie, one image captures the rover looking directly at the camera, while another shows it gazing down at a drill site for rock sampling. Mouth taping has gained popularity recently, often endorsed by celebrities, but a new study reveals that this practice may not be as beneficial as many believe. Led by Dr. Brian Rotenberg from Western University, the research reviewed 10 studies involving over 200 patients, uncovering mixed results regarding the effectiveness of mouth taping for obstructive sleep apnea. The findings raise significant concerns, particularly for individuals with undiagnosed sleep apnea, as the practice may pose serious health risks. The researchers pointed out notable limitations in their analysis, including small sample sizes and variability in mouth taping methods across studies. Ken O'Halloran from University College Cork emphasized that most studies on mouth taping are of poor quality, further questioning the reliability of their findings. Experts strongly advise against the practice, urging individuals with breathing difficulties to consult healthcare professionals rather than relying on social media trends. Dr. Rotenberg stressed the importance of seeking medical advice for those struggling with nasal breathing to identify potential underlying issues, such as a deviated septum or nasal polyps. The study also highlighted risks associated with mouth taping, including potentially fatal suffocation, which underscores the need for caution and further research to explore any clinical benefits. While some advocates claim that mouth taping can enhance airflow and improve sleep quality, these benefits largely remain anecdotal and lack substantial scientific support. Notably, none of the studies reviewed addressed daytime symptoms related to obstructive sleep apnea, such as fatigue and headaches, which are critical for patient health. Experts caution against self-diagnosing breathing issues, likening it to overlooking serious vision problems. The study ultimately warns against following online health trends without scientific backing, emphasizing the necessity of informed medical advice. Mouth taping is particularly discouraged for children, and while it may have minimal risks for some healthy adults, further research is essential to confirm its safety and efficacy. This has been your Daily Brief in Science. To read more about these stories, follow the links in the episode bio. You can also subscribe to these updates via email at www.brief.news. For more daily podcasts about the topics you love, visit brief.news/podcasts. We'll be back Monday with everything you need to know.